with aging. My bowel function has changed drastically. My previous bowel routine was to use a suppository, insert that suppository, which I could do independently, and wait for it to work. Then go transfer onto the toilet. Sometimes it doesn't work, or you're not sure if it works. So you're constantly thinking about it. You can have accidents. It's really a time consumer and a stressor in your life. Transferring on and off the toilet became harder, much harder. And if your bowel management program takes time, you're going to be sitting on the toilet for a long time. So skin issues can become a problem.
What kind of changes as people age with SCI for bowel management? Constipation, loose stools, based on diet, fluid intake. People have problems with hemorrhoids, fissures, prolapses. Often people will have a lot of pain with constipation. That pain can cause an increase in spasticity. They might be prescribed medications that are affecting their bowels. Antibiotics often cause loose stools. Narcotics, pain meds often cause constipation issues.
I was put on antibiotics for a long time because of some skin problems that came up through aging. Whenever I was prescribed antibiotics, I would have bowel problems. They never recovered. They never got back to normal. I was having accidents, having to get assistance all the time. The process for changing my bowel management was long. I think part of it was because of the negative connotations with a colostomy. I went to an ostomy nurse and talked to her. I did a lot of research. I talked to people I knew who had a colostomy. I went and I talked to a surgeon, and if I didn't like it, it was reversible. So I tried it, I got it. There's hundreds of different types of equipment. They're called ostomy bags, and you have to figure out which one works for you. It doesn't smell. They've created ostomy bags that cover the smell very, very well. I know people have had colostomies for 20, 30 years with no problems.
There's lots of questions to ask when it comes to bowel management and aging with spinal cord injury. Everybody's medications are different, their diet's different, their activity level's different. So it's a real recipe. It takes a while for people to figure out their recipe. And the recipe has to change all through the years. Are they drinking enough, making diet changes? Tolerance for the gut isn't always the same as 20 years ago. It's keeping bowel journals, writing things down, making changes one at a time, go slowly. If they have issues getting on and off the toilet, if there's mobility issues, is it time to put in a lift? Maybe caregivers need to be accessed. If someone with a spinal cord injury that's aging has tried everything, then ostomy might be their last choice, where the bowel's been resected and brought to the surface of the abdomen, and a stoma is created and a bag is worn to collect the stool. It can be a small bowel ostomy, an ileostomy, or it can be a lower bowel ostomy, which is a colostomy. Sometimes that person finds that their bowel management is easier.
Essentially, the colostomy means that I can just roll over in the morning and get out of bed. I don't have to worry about it. I change it once a day and life goes on. You can plan for it. So you can say, I'm going to change it at 3 because you got a break in your day at 3.
Making changes as you age, it's when what you're doing right now isn't working for you. I think the biggest thing is asking why.
I would recommend for anybody that has a spinal cord injury to look at their bowel routine, figure out what it does in their life. If you're considering it and you have some hand dysfunction, just talk to some other people that also have hand dysfunction that have it. The one thing that I would recommend is that spinal cord injury patients are educated about the bowel management options early so that they know that they have more than one option. I can do anything I need to do when I need to do it.